Hi, I'm Dr. Mavani. Congratulations! You are about to embark on one of the most wonderful journeys of your life. It's going to be exciting, but it's going to be filled with questions. I'm here to answer some of those questions for you from all the questions that I have encountered over the last 17 years of pediatrics. Some of you are in the early phases of the pregnancy, and some of you are already towards the end. Either way, you are trying to decide on a pediatrician and a practice that will take good care of your little one. If your prenatal ultrasounds and your antenatal screenings have all gone well, that's wonderful. If there are any issues that have shown up during this time, it is a good time to bring it up with the pediatrician during the pregnancy consult so that they can address any plans that you might need to make for special care or for any kind of transfers if necessary. During this visit, take your questions with you. If you have a list, that's great. If you don't, you can access a list at our website www.drmavani.org. The issue of circumcision comes up commonly during this visit. Circumcision is not a medical decision. It is a personal or a religious one. The OBs do the circumcision, not the pediatrician at the hospitals that we are affiliated with. If you have any questions about it, please address them with your OB. The other question that I very commonly encounter is about cord blood, transport and storage. We do not recommend the cord blood storage unless and until there are medical problems. If there's a family history of hematological issues or blood disorders or any kind of genetic anomalies, you may want to specifically ask whether cord blood will be helpful or important in these cases. If there is no history, then the American Academy does not currently recommending storing of the cord blood just for routine purposes. Once your little one arrives, it's going to be great. You're going to be at the hospital, but it's also going to be a bit chaotic. You're going to be surrounded by lots of people, friends, family, doctors, nurses. There's going to be a lot of questions that are asked of you. So this is a good time to get some of the information together and maybe carry some of the materials with you. The questions that you will be asked will be related to if you want to make certain choices about vaccines, about vitamin K injection, as well as eye drops. The eye drops are antibiotic eye drops that we highly recommend to prevent the little one from getting any kind of infections contracted through the vaginal fluids. We also recommend the vitamin K shot, which is necessary for any bleeding disorders that might show up later. The vaccines that are offered to the baby are the hepatitis B, and we also offer the Adacel to the mother. The hepatitis B vaccine is ideally given in the hospital. If you wish to defer it, please make sure that you are very confident that your hepatitis B status is negative and have the blood work to prove it. The OBs typically will screen for hepatitis B status on the moms that are about to deliver. If your hepatitis B status is negative, you may wish to defer the vaccine, then you will be asked to sign a refusal or a waiver. The Adacel that we offer to the moms is to protect the babies from pertussis or whooping cough. This is a newer policy that has been put in place to make sure that the mothers are adequately protected. The vaccine will make sure that the mother does not get any kind of an infection that would carry the pertussis bacteria over to the child. The father, as well as other caregivers, including grandparents, should also ideally get the vaccine. Pertussis requires a circle of protection around the baby to make sure the baby, who is the most vulnerable to this disease, does not contract it, because the baby's first vaccine is not till 2 months of life, and they do not finish getting vaccinated till 5 years of life and then receive a booster at 11. If you have any questions about vaccines or vaccination schedules, you can go back to the website to the vaccine page and recover information from various reliable sources such as the CDC, or other sources like the American Academy of Pediatrics. There is a huge debate about vaccines currently in media as well as online, and there are benefits to vaccinations, but there are also side effects. Every child is different. We do not accept patients that do not vaccinate, but we are willing to do a slower schedule that's medically reasonable and acceptable and does not put the child at risk. Please feel free to discuss this with us. We offer a middle-of-the-road approach to the care of your child, blending the best of integrative medicine with traditional medicine. If you are interested in the alternative approach, please feel free to ask any questions. The alternative approach also focuses on prevention. We believe that the food that you put into the little one, the nutrition that they receive, and the counsel that you receive on raising them helps to make a very, very healthy child. We are a part of your team. We are a part of making sure that your child is healthy and stays well. If you have any other questions relating to the care of your new one, please don't hesitate to call us. We are available 24/7 for emergency calls, and we are affiliated with Royal Oak Beaumont, Troy Beaumont, as well as Crittenton Hospitals. Thank you so much for your time, and congratulations again. Enjoy your journey.